Hello, everyone, and thank you for joining today's webinar. We're really excited to have you all here, and we want to get started right away. My name is Tim Lopez. I'm on the marketing team here at Collective Health, and I'm going to pass this over to our host shortly. But before I do that, I do have a few housekeeping items to address. First, you are all on mute, but there's a Q&A box on the bottom of your Zoom screen, and we'd love to have you submit your questions. We've allotted about 10 minutes at the end of the session to answer as many as we can, and if we don't get to your questions, we encourage you to follow up with us to continue the conversation. And you can reach us at webinars@collectivehealth.com. You'll see that address at the bottom of the screen there. Second, you'll see some in-webinar survey questions, both on the side and a few that will pop up throughout the presentation. We'd love to have you answer those as well. Lastly, if you have to jump off for any reason or you want to share the webinar with a colleague who couldn't be here, we will be recording today's session and making that available for you all afterwards. So with that, I will kick it over to our host, starting with Hope Craig. Take it away, Hope.
Good morning, everybody. Thank you, Tim. Thrilled to be here. My name is Hope Craig. I am the Vice President of Client Success here at Collective Health. And I want to thank you all for taking time to join us this morning. We actually have a great collection of folks on the phone with us joining this webinar. I promised Cindy I wouldn't say how many there are, but we have a number of consultants and broker partners on the line with us, along with some senior benefits folks from a number of companies across a number of different industries. So really glad you could join us today. And really thrilled also to be joined by one of our newest clients, Cindy Ripley from the legendary Specialized Bicycles Company. Want to turn it to you, Cindy, for a quick hello.
Thank you so much, Hope, and thanks for not mentioning the number on here. As Hope mentioned, I'm the People Ops Manager here at Specialized Bicycles. I oversee a small team that is responsible for everything from global mobility and HRIS systems to the very important health and wellness benefits for our U.S. teammates.
Great. Well, I'm going to be sharing with folks a little bit about Collective Health in a few minutes, but first, let's start, Cindy, by you telling us a little bit about Specialized Bicycles as an employer.
Absolutely, yes, the legendary Specialized Bicycles. As you can see, we've been around for about 46 years, producing what I consider to be the best cycling product out there. We actually love our bikes so much that we get right in front of those two doors in this picture every day at lunch and go for about an hour-long ride. And you can see that in every office across the globe. We have about 650 teammates here in the US. And those are, I mean, basically every background that you could imagine. We have some interns that are starting with us and hopefully going full-time. And we also have teammates who have been here for about 40 years. We also have quite a few expats that have joined us throughout the years from all over the world. And so they're navigating our healthcare system for the first time. Like I said, we all meet up every day at lunch for a long ride, and that translates into our lives overall. We're all very active. We're constantly out on the trails or the road on the weekends. And my team also sits right in that building. We have about 12 people and culture folks here who support the global workforce.
Great. Well, so what was it like for your people and culture team before Collective Health?
Yeah, I stepped into the People Operations Manager role about a year ago, and I very quickly realized that our teammates had a lot of questions about benefits, everything from claims processing and payments to eligibility issues. It was very clear to me that our benefits experience was not the best for our teammates, and we just didn't really have the control to improve it at the time. And I knew that that wasn't the type of team that I wanted to lead. And it's also not the type of work that I wanted to be doing. I really wanted to be able to work on the strategic standpoint of this role. So it became pretty clear that we needed two things before I could move into a different level of the role. We needed a partner that could provide the service to our teammates that they deserved, creating a seamless experience for them and their families. We also needed a solution that brought together all the different elements of these benefits and made it easy for the people and culture team to manage. So we decided that it was time for something new, and we were very lucky that our brokers introduced us to Collective Health. And after the first meeting, the decision to work with them was a really natural one.
Yeah, and really, Cindy, hearing what your experience was before really highlights, for me especially, why Collective Health would have been a fantastic partner for you. we actually hear those same experiences and desires around wanting to work on strategy, wanting to create a better experience for employees and navigate a way to manage the investment from a lot of our clients. Interesting really to hear you echo those sentiments that we hear from a lot of folks. With that, I really want to take a few minutes here to provide some background on Collective Health, especially for those people on the line who aren't familiar with it, and really to talk a little bit about how we solve for some of the things that you've just mentioned. But it's hard to have a conversation about benefits if we really don't start by taking a look at some of the roots of the problem. And I'm imagining everybody on the phone is really going to recognize these as universal concerns. I mean, the first is that the cost for healthcare is completely out of control. And it's not just, providing healthcare for employees. It's really thinking about this massive investment that our clients or that companies and organizations are having in offering benefits to their population. And in addition to that, navigating health benefits is just so frustrating for employees, which is really what you just expressed as well. And it's not only frustrating, it's partly frustrating because it's so darn confusing. And so, when we see employees that can't navigate, they really don't feel empowered to make use of all the resources and the investments that you've made in an overarching benefit strategy. And then the third problem really is that benefits teams are spending so much of their time putting out fires, really trying to be the glue between a bunch of disconnected benefits and systems. And it really takes away from their opportunity to be strategic, which I know you come to that as well. So really, especially to that third point, when you think about what it takes to run a health benefits program, it's just really super complicated and very involved. It starts really with, folks like you, Cindy, and benefits leaders on the phone, and their people trying to offer and navigate through sort of the basic elements of a healthcare or a benefit strategy with medical, dental, vision, and pharmacy. So that's already complicated enough, trying to tie that together. But then, add on some administrative services that things like stop loss or health funds or COBRA, then if you get really excited about other programs like disease management or wellness programs, maybe even on-site clinics, outsourced member support, this just really gets so confusing, and not just for your members, but also this is what it looks like for you as a benefits leader. And the way Collective Health looks at it, we think it's got to be better than this. And so, Cindy, when I hear you describe the problem of employee confusion and all the work that you have to do, we really feel like it comes down to a lack of integration. And what we've built here at Collective Health is just one platform that connects all of your programs in your benefits investment. It runs your health plan, engages your people, and optimizes that investment all in one place. So what does that actually look like? We are a flexible platform that benefits leaders can use to do the following things. So we connect all of the benefits programs, including medical, dental, vision, and pharmacy. We enable your BenAdmin's platform, and we also tie in any of the digital health programs that might be exciting and really great for your population. Then we actually run your health plan. So we're adjudicating the claims. We're managing eligibility and payments for all of your partners. We engage your people. So, in addition to our mobile and web tools, we've got the member advocacy that engages folks and helps them understand and navigate the benefits program you've designed. And we're going to talk about this in a little bit, but we also help with messaging, so open enrollment and other messaging to help engage your folks and help them understand what you're offering. And then finally, we optimize your investment by giving you dashboards and reporting and insights that really help you understand how your investment is performing. And so the idea is really to give benefits leaders the flexibility to design a strategy that makes the most sense for them and their organization, really without all of the complexity and the heroics that it takes to manage that today. So, one of the common questions we often get is, okay, this sounds really great, but it also sounds expensive. And What's important to remember is that we're actually replacing a patchwork of costly solutions to deliver a more unified program in a connected way that delivers better value to you and your people. So to recap all of this for you, this is really what it looks like when you bring together plan administration, patient navigation and advocacy, an employer's ecosystem of programs and benefits and analytics all into one platform. And you take what's on the left and separate it, and you move it under a single roof on one platform that you see on the right. So it's your strategy is really more powerful, and the total investment on behalf of your employer is lower. And so the ultimate question is, why would you make the switch? And I might actually change the question to why would you make the switch? But Cindy, I really want to talk to you now and turn it to you for a conversation around what it was like for you making this decision and what went into it for Specialized. And so with that, we have a few questions. Really wanted to start with asking you what you were looking for in a new benefits partner.
Absolutely. Before I answer that, I think it's so important to share with everyone one of the founding principles that I really admire with Specialized, and that's innovate or die. So you see that in every product that we do here and everything that we deliver to our customers, but also everything that we deliver to our teammates. So I'm constantly looking for partners who live in that same space of innovation that we do. And that's something that I honestly saw in Collective Health and what they were delivering in their product. For instance, the system that we were using previously didn't have much oversight, and I felt like I was constantly chasing different people for answers and creating such a lag in response and troubleshooting for our teammates. And I just really didn't like that experience for anyone. While we did have some external partners in place for claim support and member advocacy, there wasn't a lot of conversation between the two, and I felt like I was having to manage that too closely and spend too much time on it. So like I said, when we met with Collective Health and really saw that shared product philosophy that embodied the innovate or die mentality, I was so excited that they were doing this in the health insurance industry and really creating that unified experience for myself and my teammates.
Yeah, that's great. Well, what can you say about what the impact has been on your team and for your employees since you joined the collective?
Yeah, for our, I call them teammates, but for our employees, we've really seen a better experience. And that was the most important part for me, because at the end of the day, those are my customers. This started with open enrollment. So we started in November with open enrollment, and Collective Health provided such a high touch experience at two of our locations actually, and it really resulted in a high turnout from teammates that we had not seen before as part of open enrollment. When they did come on site, they brought this energy that was honestly infectious, and we saw really strong engagement levels for the employees that did get to attend those events. And it wasn't just those on-sites, because we do have 650 teammates out in the field and at our satellite offices. And Collective Health was so awesome at catering to the different needs. They did a webinar with us similar to this for our teammates. They took phone calls, they took emails, basically anything we asked for, they did for the teammates. And so that was a really helpful during the open enrollment. And recently, so we've been live with Collective Health about 2.5 months now, and my boss sat down with me for one of our regular one-on-ones and proactively just said, by the way, I called Collective Health the other day about some claims and they were awesome. And, you know, that's the teammate that I really love to hear that amazing feedback from. So overall, I would just say our teammates are really getting those quick responses to their questions, and our new hires are also experiencing a really seamless onboarding with that partnership. And then again, this can't be missed, but our people and culture team has really seen a shift in what we're providing day to day. Collective Health has stepped in and brought that one solution in one platform. So we have this one source of truth to go visit if we have any questions. And that has just created our day-to-day space that we need to work on other items. I also look back on the implementation process and what that looked like for my team. And it just felt like such a partnership, which I really appreciate with Collective Health. There were so many things to navigate. We had new contracts, a new HRIS integration, our single sign-on for the portal. And it was honestly daunting, but only for a few days until I saw the plan that Collective Health outlined for us. And they just stuck with us so closely to meet that tight deadline. So they worked so seamlessly with us, and also really importantly, our brokers.
Yeah, that's awesome. I love hearing those stories. I mean, we really crave hearing about the amazing member experience we deliver to teammates, and really love working so closely with our clients for their experience as well. So I'm thrilled to hear that that's been your experience, and really wondering now what you're looking forward to as our partnership evolves together.
Yeah, I'm looking forward to so much. Like I said, the bills are now getting paid on time. Our teammates are being taken care of. So I have this new space to think about what's next. And I'm really excited to look at strategy with the team, and be able to understand how our teammates are utilizing the product or using our health and wellness benefits right now as we look to the future. I'm also really excited to partner with Collective Health to understand what other benefits or digital health programs we could add that they have as part of their offering.
Mm-hmm. Yeah, exciting. We're so excited to have you as a partner, Cindy, and can't wait to dig in. It seems like we have gotten some questions. Tim, can you talk us through some of the Q&A we've gotten so far?
Yeah, absolutely. We got quite a few. I think first, a few of you are asking if the presentation will be sent out. Yes, we will be sending it out in an email to you later today, so you can go back and rewatch the recording. Another question we got, Cindy, this one's for you, just about implementation. I know you mentioned it shortly ago, but they're just wondering if you could go a bit deeper on what the implementation process was like with Collective Health and what was different about it from your perspective.
Yeah, that's a really good question. The implementation process, looking back on it, was exciting is a word that comes to mind. We started with a big on-site meeting here at Specialized, so Collective Health came down for that, and we had all of our key players there. We had our systems team, some of our finance team, IT, just all those big players. And like I said, we really mapped out what it would look like for the next few months to make sure that we hit all of those milestones and deadlines. Collective Health came with a lot of information. There's this implementation hub that I really loved, and it has all these guides. But that being said, they really listened to me and what would work for me to move forward. So we had weekly calls, we had follow-up emails, we had an awesome manager who really worked closely with us. And to be honest with you, he partnered with everyone along the way. So things would kind of happen in the background without me even knowing. And that was a really great feeling.
Great. A follow-up question to that we got is just, were there anything, any challenges or anything unexpected during that process?
Of course, there are always some unexpected pieces. I think part of it was the questions that some of our teammates had along the way. And by that, I mean the group that was helping with the implementation. I had to learn a lot about systems during this and a lot about IT during this place. So what I really appreciated was the partnership that our implementation partner brought from Collective Health. We really learned together along the way and solved those pain points or answered those questions together. So I did not have to feel like I was in it alone. So yeah, that was kind of the only unexpected piece that comes to mind right now.
Great. Another question for you. We're considering moving away from a carrier that we've worked with for a while, but are concerned about employee disruption. Was there any friction in the process of communicating Collective Health to your employees?
Another great question. We also had a trusted partner that we had been with for a few years on both our processing side and then the teammate facing side. And their information had been out there for a long time. But like I said, Collective Health partnered with us to just be very high touch during the whole process. So beginning with open enrollment, they would see Collective Health information everywhere. We shared this information on an array of different platforms, so email, posters, team meetings, everything along the way. And for us, it was actually a pretty smooth transition because we were so high touch during those first few months.
Great. One more for you. You mentioned it was a very collaborative process with your broker. What advice do you have on working with your consultant or broker to ensure a smooth transition with a new benefits administrator?
Yeah, I touched on this a little bit, but just understand your preferred way of working. So like I said, the collective health team came in with a lot of information and they were very prepared. And I was very lucky to share with them how I prefer to project manage and how I prefer to work with our team. So they quickly adapted to that and had those weekly calls with us. And, for instance, I asked them to work directly with our brokers in a lot of cases and only loop me in at the end. So just be very clear on what you expect out of the working relationship and know that they'll deliver on that.
Great. Well, I think that's most of the questions we've gotten so far. And again, we'd love to continue the conversation if anyone does have other questions. So email us at that alias webinars@collectivehealth.com and we can take it from there. But thank you again to both Hope and Cindy for today. And thank you to everyone that joined us. We are going to follow up with a few resources in addition to the recording, including some more stories from benefits leaders like Cindy, as well as our new collective health overview. So look out for that. And again, thank you for joining and have a great rest of your week.